Hey, Prednisone Warriors, Dr. Megan here. I have some things to share with you today. This is a Q&A with Dr. Megan, the Prednisone Pharmacist. And so I'd love if you comment below what your questions are. I'm definitely going to be covering pain with prednisone withdrawal or pain while tapering off prednisone, just pain in general. People seem to be really struggling with that. I've been getting a lot of questions about that. So I just really wanted to cover that more in depth today. Other than that, please comment below what your questions are. So, here are some questions I have recently gotten. I'm just going to read this story of this personal experience somebody's having because it seems to be kind of the same story a lot of people are having. She said, "Hi, Dr. Megan. Thank you so much for your personal perspective and clear information on how to navigate prednisone. I've been on and off the drug since February of this year due to extreme bilateral carpal tunnel pain. Fill in the blank, like due to extreme fill in the blank, right? Like for lots of other people's diagnosis. Initially, it was thought that I had a pinched nerve because I had neck pain as well. Good news, neck and wrist are unrelated. Bad news, over the counter NSAIDs like ibuprofen, naproxen were not doing the trick when the wrist would escalate to the point I couldn't sleep at night. Giving you the backstory because I am not your typical prednisone patient. I followed a lot of your great advice on how to navigate prednisone. But boy, oh boy, I did not understand how prednisone withdrawal can be really difficult. Amen. I woke up with pain in my neck, shoulder, elbows, knees, ankles. And when I didn't manage my taper like I should have. So if she didn't do her taper right, she woke up with tons of pain. I was in so much pain. I started looking for a rheumatologist because I feared I had rheumatoid arthritis rather than just carpal tunnel and neck issues. Which brings me to my question for you. I would like to decrease and taper off prednisone 100%, but I don't know how to manage the joint and muscle pain. That is pretty severe for me. I've been doing a lot of reading. I wonder if you have any experience or opinion on low dose naltrexone for pain management as you come off prednisone. I've read a lot of studies and looked at the opinion of pain doctors, and it seems like LDN, which is the acronym for low dose naltrexone, would be a good bridge to deal with pain that comes from prednisone withdrawal, and it helps rather than impairs the immune system. I really value your opinion and feel like there is not information out there to effectively deal with the pain that comes after you stop using prednisone. It feels like the prevailing opinion is it could take months or years for your body to get back to normal. But how do you deal with the pain? Eat Advil like they're Tic Tacs? Go to the opioids to deal with the pain? Go for high level NSAIDs like Celebrex, which have their own issues? Would love to hear from you, or have you used this question as a post to discuss how to manage pain post prednisone? Thank you again. Keep up the good work. Fantastic question. Pain post prednisone is real and it is something that people commonly experience. It's also known as prednisone withdrawal pain or glucocorticoid withdrawal pain or corticosteroid withdrawal pain. And it's really a tough situation. I frankly was surprised when I started hearing about this from people who took prednisone. I didn't personally experience this side effect myself. And as a person who went to pharmacy school, got my doctor of pharmacy degree, became board certified, and then became a prednisone patient, in none of those times did I ever hear of pain post prednisone. I never heard of prednisone withdrawal in any of those times. It was a complete shock to me when I became the prednisone pharmacist and thought, hey, I can help people with prednisone side effects. And I'd never heard of withdrawal in any of those times. Like, it's not something that they teach about in pharmacy school. As far as I can tell, it's not something that's commonly taught in medical school. It might be in certain medical schools, but as far as I can tell, this is not a topic of discussion that people bring up, like pain and prednisone. It's not a super common topic of discussion in school. So if you're experiencing this, comment below. Hey, I've been having this pain issue. Comment below what other questions you might have about prednisone. I'm going to keep going deep into this pain post prednisone and withdrawal pain. But if you have other questions, please comment below what those are. So I actually have a scientific article that a doctor posted. Okay, so this is the Journal of Pain and Symptom Management. Doesn't that sound like the perfect journal to be answering a question for us? And it talks about, in the introduction, is like it's frequently prescribed, but steroid withdrawal may be frequently underdiagnosed and untreated. Because if doctors haven't heard of it at medical school, and then they're not going to know to treat it, and then it's causing significant pain for people. And the symptoms are broad. I love how it talks about how this is just a broad array of symptoms and they're not well recognized. And fever is one of them. It's so weird because normally if you have a fever, that means one thing, right? You're sick, you have an infection. But when it comes to prednisone, it's like, actually, is it? Like, is the fever an illness or is it withdrawal? And so here's the definition of withdrawal syndrome. Objective syndrome resembling true adrenal insufficiency and characterized by fever, anorexia, nausea, lethargy, malaise, arthralgias, desquamation of the skin, weakness, and weight loss occurring with highly variable grading in patients undergoing steroid withdrawal, also in the presence of biochemical evidence of hypothalamus pituitary adrenal system integrity. Would you like me to translate that into English? So basically, it's saying your adrenal system is working, but you're going through misery. Fever, you don't want to eat, you feel exhausted and yucky, you have joint pain, your skin might go weird, you might be weak, you might be losing weight, and it's awful. And I don't see actually joint pain. I don't see muscle pain listed, but that's often also a definition is muscle pain. Oh, here we go. Other symptoms: abdominal pain, vomiting, low blood pressure, postural hypotension, hyponatremia, and hyperkalemia. So, all of these awful symptoms people experience. And here we go: fatigability, myalgia, arthralgia. So, those big words means you get tired easily, you have muscle pain, joint pain, and emotional instability. So, these happen. It's real. You're not imagining it. It's not some new disease, although it could be, and definitely talk to your doctor about it. And they just talk about other like cases. But what I really want to get to is here the treatment of steroid withdrawal syndrome. So they're like, if they're having a fever, you should make sure they're not actually sick. But if a person is not actually sick, having these miserable feelings, reinstitution of oral steroids. Like, this is the worst news I can share with people. Like, nobody wants me to tell them, hey, just, like you've worked so hard over how many months to taper down slowly over prednisone. Like, say you started out at 20 and then you went to 17 and a half, then 15, then 12 and a half, and then 10, and then you went down by 1 milligram a month, 9, 8, 7, 6, 5, 4, 3, and now you're having withdrawal pain. I'm telling you to go back up in dose. Like, what? Like, that is the worst news. Like, I remember when I was taking prednisone, how awful it was when my doctor's like, actually, your autoimmune disease is flaring. We've got to go back up in dose. And I'm like, no, I'm not going back up to 60 milligrams. Like, not again. I don't want to do that again. I'm sick of gaining weight. I'm sick of moon face. I'm sick of insomnia. I'm sick of all of it. I don't want to do it again. And like, if you're having this, it means go back. Like, no. Like, current literature supports reinstitution of steroids as the mainstay of treatment in steroid withdrawal syndrome. That is like the worst. So, like, another guy asked me, he said, are there any supplements you would recommend that encourage the adrenals to wake up and recover better and faster? Because he's experiencing all those symptoms too. Like, he has talked in depth with me, scheduled an appointment. And he's like, what can we do? And basically, he's wondering, are there any supplements that would encourage the adrenals to wake up? I can't say that there are any safe supplements to encourage the adrenals to wake up. Like, there are adrenal supplements, adrenal support supplements, cortisol manager supplements, none of which I would recommend while you're taking prednisone because they're designed for people who are not currently taking prednisone to help their body start making cortisol more or better. And they are going to interfere with the prednisone if you take them. It's a drug interaction. Don't mess with them. Like, those are not safe. So here's a question just came in. I'm going to share this. Emailer says, is there any amount of time if you could tough it out that the withdrawal pain will go away and you could get off the prednisone? So I'm not aware of any scientific articles studying this. The only stuff I find is saying, if you're having this, you go back. I've never talked to anyone who's like, yeah, I toughed it out and I'm fine. Like, as far as I can tell, toughing it out doesn't work. Maybe it does, but I have no evidence to support saying, hey, just tough it out. It'll go away eventually. Like, You might be stuck in bed for a month and agonizing pain, not able to feed yourself or dress yourself because it hurts so much to move, but it'll go away after a month. I can't say that. Like that's not true. There's no evidence to say toughing it out will work. As far as I'm aware, with the evidence available to me at this moment, the only thing you can do is if you are going through prednisone withdrawal, is to go back up on the dose that didn't cause prednisone withdrawal. So if you were going from 10 down to 7.5 and you're like, it's awful, go back up to 10. Stay there longer. And instead of dropping from 10 to 7.5, like that's 25% drop. We want to focus on percent drops and not milligram drops. Dropping from 20 to 17.5, that's only 2.5 milligrams. 10 to 7.5 is 2.5 milligrams. But the percentage drop from 20 to 17.5 is like somewhere much less than 25%, right? It's like 12.5% or something, right? Something, I can't do the math while I'm live, but it's a small percentage compared to a 25% drop. We want to keep it 20 to 10%, like a smaller percentage drop. So instead of jumping from 10 to 7.5, go 10 to 9. Get access, have your doctor prescribe 1 milligram pills of prednisone. Like, do that instead. And by the way, I've got to give this disclaimer. What I am saying here is general information. It is not medical advice. Talk to your doctor about that. Your doctor is your expert on your medical care. Okay. There's your disclaimer. Make sure your doctor is your medical expert for you. So I don't know of any amount of time. It's not like, oh, if I tough it out for a day, a week, a month, a year, I don't know of any of those that it's like, ooh, that's perfect. And so emailer says, okay, thanks. I kind of figured that was the case. Yeah, that's the case. There's no evidence showing this is going to work, unfortunately. I wish we had better information about this, but at this time, there's no answer to that question. So back to the other prednisone warriors question. He said, so are there any supplements I would recommend? No, there are no supplements to wake up adrenals for that specific purpose. I don't know of any. He said, in addition to as to which supplements help adrenals wake up, he's on low funds, so he can't buy pre-made supplement combinations. So what he's referring to there is Nutranize Zone. This is the pre-made supplement combination I invented to help people on prednisone to give you all the nutrients you need to support you while you're taking prednisone. And people have told me that it helps them to taper. So this is exactly what you need, but it's not going to wake up the adrenals. Okay. Like there's a difference. This is going to support you nutritionally, support you with the side effects. It's not going to wake up the adrenals. All right. It is fantastic if you're taking prednisone and you need support. Basically, everybody does. Unless you're super good at eating calcium containing foods, you need to be taking something like this. At the very least, everybody on prednisone is supposed to be taking calcium and vitamin D. That's what the American College of Rheumatology, their guidelines say. You should be taking calcium and vitamin D. But they don't include vitamin K2, MK7, which is going to keep that calcium from depositing on your arteries and hardening them, is going to help that calcium go to your bones. And those are just 3 of the 17 ingredients in here. They're all designed specifically to support you while taking prednisone. And you can get this at nutranize.com or on my website. So you can find Nutranize Zone to support you while you're taking prednisone. It's exactly what you need. So let's get back to his question. He said, which supplements help adrenals wake up? Like I said, none of them. He can't buy that pre-made supplement, but what helps? B complex, vitamin C, and he help is appreciated. So let's talk about B complex first. So Nutranize Zone does include B vitamins. It includes the best kinds of them. For example, methylated folate, the L7 methyl tetrahydrofolate is in here. And so, yes, folate and B3 and B1, all of those B vitamins are really going to help support your body while on prednisone. You need it to help you cope with the side effects. And then he says vitamin C. Vitamin C is in here too. There's evidence showing that your body is excreting vitamin C faster than normal while taking prednisone. That when they supplemented vitamin C to people who are on injected prednisone, which is called either Withdrawal or another kind, they did better in the ICU in the hospital if they had vitamin C along with the steroid. So you need vitamin C while you're on prednisone. And then he said, any help is appreciated. Yeah. So those are great. Like if you can't afford anything else. Get yourself some calcium and vitamin D and a B complex and some vitamin C. That's going to be a lot of pills. And by the time you bought all that, you've almost paid for this itself because this is 2 bottles. It's an entire month's supply. Like, whatever. Okay. He says, what else helps to awaken up adrenals? So these are great questions, and let's talk about those. So, what else helps to awaken adrenals? And he says, exercise. That's tough for me because of the breathing issues, but right now that's doing better. I can take walks. Certain types of exercise are better. Does that help waking them up, or is it worse to exercise when having suppressed adrenals? Does that lower the blood sugars too much, or is it good? So let's talk about exercise, prednisone withdrawal, adrenals. Let's talk about the whole thing. So if you are in true prednisone withdrawal and you're having muscle aches and pains, exercise is going to be an almost pointless endeavor because you're going to be in so much agony. So it's not going to help. Like, it's not going to push you through. It's not going to solve the adrenal withdrawal problem. Exercise is a great thing to do while on prednisone, but it's not going to wake up the adrenals or get you out of withdrawal. Like, exercise, I recommend is as like a great thing for everyone on prednisone, but it's not going to accomplish the goal he wants it to accomplish. It is not going to wake up the adrenals. Okay. And then let's talk about the blood sugars he's talking about. Because when you're in withdrawal, the blood sugar can be kind of weird. Like when you are taking high dose prednisone, your blood sugars are super high. But when you are in withdrawals, sometimes you can get low blood sugar. And so I wouldn't assume that exercise would cause blood sugar issues. If you're in withdrawal, it just might make your agony worse. Okay, then he says certain foods to awaken up adrenals. I'm not aware of any foods that awaken adrenals. Does sleep help? Do naps, or do they only suppress things more? As far as your adrenal system and sleep, keeping a steady sleep rhythm, going to bed at the same time, waking up at the same time is really helpful to support recovery of your adrenal system because that's part of how the adrenals recover is by knowing when is wake up time. When is sleep time? Having a circadian rhythm that mirrors the sun, for example, waking up when the sun comes up, going to bed when the sun goes down, right? Like that rhythm that humans have been doing forever is really important to support your adrenals if you can. If naps are making it so you're not able to fall asleep at night, and so now you're staying up all night and then you're taking a nap during the day, like you got to listen to your body and do what you've got to do. If you're truly in withdrawals, you're probably exhausted and need a nap, but is it keeping you from sleeping at night? So, like, you got to find that balance for you. Ohio Beverly says, is it accurate that you can taper from long-term high-dose prednisone quicker on rituximab infusions? So tapering has several things we have to keep in balance. So when it comes to tapering, there's basically the two things we're looking at. We're looking at your disease being under control, and then we're looking at preventing withdrawal symptoms. So far in this conversation, this whole video, I've been talking about withdrawal symptoms, preventing withdrawals, helping us deal with withdrawals. But if you're talking about tapering long-term high-dose prednisone because you're keeping your disease under control, then the answer is yes. Getting on an alternative to prednisone, a biologic like rituximab, that's what I personally did. That's what got me off of prednisone, or Humira, or going on another pill like methotrexate. These alternatives to prednisone to help your disease get under control are a great strategy. Like, I personally believe, and I have Harvard professors who agree with me, and the guidelines agree, that pretty much every drug is safer than prednisone. Like, prednisone is the worst drug you can be on as far as safety goes. And so, going on a drug like rituximab or methotrexate or Humira to get on lower doses of prednisone is fantastic. Like, do it. All of those drugs are a better option than prednisone. Like, people are scared of them, like it's an injection, or it has the letter X in the middle of it, or it's been used for cancer. No, prednisone's also been used for cancer. Prednisone causes more side effects than any other drug. Like, do whatever you can to minimize the dose of prednisone to get you on the lowest effective dose of prednisone. Don't go into withdrawals. That's the other conversation we've been having. But if you can go on rituximab, that's fantastic. Like, that is how I got off prednisone. That was what solved the problem for me, was rituximab, also known as Rituxan. It had side effects too. Like, I'll tell you my quick experience of taking Rituxan because I'm guessing that's something you might be interested in. When I was taking prednisone, I took it for a disease called ITP, where my body was attacking my blood cells called platelets that are responsible for clotting. And so I was going to bleed to death over and over and over again. Like every time I tapered prednisone, my disease would flare, right? And so I'd have to go up higher dose, higher dose, higher dose. And it was a miserable journey. It was so awful. And so then the doctor's like, hey, we can either take out your spleen, which might be causing these attacks on your platelets, or we can give you chemotherapy or immunotherapy in the form of rituximab. I was like, sweet, let's try that one. I don't want to go under the knife. I don't want to donate an organ. I want to just keep my body intact. And let's try this chemo thing. As a pharmacist, I knew that this drug can come with side effects and that a lot of people have allergic reactions to rituximab, like have infusion reactions that it can cause in very, very, very rare cases, fatal reactions. So I was worried about that. So I called my friend who's an infusion pharmacist who works in the transplant part of the biggest hospital in my state. Like, he's, like, the number one guy I could possibly call in my state. And I was like, "Is this real? Like, is this just an artifact that's in the medical literature? I'm worried about it. What should I do?" And he said, "I've never seen it in my 15 years practicing pharmacy in the hospital. It is definitely a possible reaction that somebody could have, but if you were to have an infusion reaction, an allergic reaction to the rituximab, you're in the hospital for this infusion, they can take care of that reaction. They can support you. You're not going to die." I'm like, okay, sweet. And so I went in, had my first infusion. They gave me Benadryl and Tylenol to hopefully suppress any infusion reaction I might have. But guess what? I still had an infusion reaction. My palate up here got all tingly, kind of the back of my throat got all tingly. And that's like a symptom of an infusion reaction. And so in that case, the nurses slowed down the infusion. Instead of having it go fast, they slowed it down. They gave me more Benadryl and Tylenol and waited 30 minutes and it went away. And so they slowly increased the dose back up and I was able to tolerate it and they were able to manage the infusion reaction and it all went well. And I repeated that I did it a total of 4 times. And by the end, I knew it was working for me, but I didn't know if it was going to last long term. And I'm happy to say 7 years later, it's still put me in remission. So rituximab is fantastic for me personally. And I've also never personally heard of anyone who's had a terrible reaction to rituximab, even among my other pharmacist friends. The next question is, what about salt? High or low salt better if you're dealing with prednisone withdrawal? Now, this is really tricky because normally, if you're taking prednisone, you're on high doses, salt is not a good idea. Like high salt is a bad idea because prednisone is already jacking up the salt in your body, which is making you hold on to fluids and suppressing your potassium, and your whole fluid balance is being thrown off. You're gaining water weight, you're peeing all the time. Like, it's just this whole mess. And so you want to just keep a healthy salt intake when you're on normal doses of prednisone and you're not dealing with withdrawal. So that's my general advice for most people taking prednisone. Definitely talk to your doctor if you've got kidney issues or other things going on. But for general people, you want to limit salt when you're taking prednisone. But when you're in withdrawal, hyponatremia is the medical term for low sodium in your blood. So at that point, should you be replenishing that? That's a tricky question. And so it's really something you have to talk to your doctor about. Like, are you actually having low sodium? Is withdrawal actually causing low sodium for you or not? And that's not a question I can answer in a live video. Like, that is really specific to your blood test. Is it safe or not? Like, it's not something I can really answer. So generally for people taking prednisone, we're not talking about withdrawal again. I don't recommend doing electrolyte supplements because they're usually really high in sodium and that's going to worsen the whole electrolyte imbalance you're already dealing with. So it's just that's a really tricky nuanced question that is really important. Peter says, I'm getting down 5.5 with my steroids, getting aches and pains. Is this normal? What? You are so awesome, Peter. That's exactly where we've been talking. Feel quite tired and down, been on steroids for years plus now. This trying to work in my workshop, making custom drums, never had pain when I go to sleep. That's so cool. You make custom drums. Very cool. So it's just so common. You're down, you've been tapering down, and now you're having aches and pains. Is this normal? Yes, it is normal. You feel quite tired. Yes, that's normal too. Do you need to live this way? No, you do not. What you're experiencing is likely prednisone withdrawal. Prednisone withdrawal is something that I didn't know about until I became the prednisone pharmacist, but it is real. It's just like if somebody suddenly goes cold turkey off of alcohol, they're going to go into withdrawals. They might even have seizures. They're going to have to be hospitalized. It's a real thing. It's real with prednisone. And aches, pains, fatigue, feeling tired, it's a common reaction. And so what do? You need to go back up a dose until you can not be suffering this anymore. It's unfortunate, but as far as I know, that's the only way to deal with the aches and pains and tiredness is to go back up to the lowest dose where you weren't feeling that. So if you're at 5.5, were you feeling that way at 6? If you weren't feeling that way at 6, go back up to 6 and then wait a while before you try tapering down again. Okay. But definitely talk to your doctor because I am not your doctor. Okay. Janet says, hi from South Carolina. I've been taking prednisone since June. I'm going through a taper now. So far from 20 to 15. I'm also taking methotrexate and folic acid. Any idea how long before I will be off? So let's talk about this. Because when we talk about tapering, there's two things we're looking for. There's prednisone withdrawal, which I just covered from Peter. And then there's your disease going into remission or into control. Okay. So there's the disease and there's the withdrawal. We've got to keep them in balance. So if you're taking methotrexate and folic acid, I'm guessing the purpose of that is to help bring you down safely on your prednisone while the methotrexate slowly kicks in for your disease. So, my autoimmune disease is inflammatory arthritis, systemic sclerosis, and PMR. Okay, well, that helps me answer. I'm going to just focus on the PMR because those other diseases are hard to give a more definitive answer because it's harder. PMR is a more clear answer that I can give you. So, if you are dropping from 20 to 15 and the methotrexate's kicking in, hopefully it's helping. If it's not, it's hard to know for 3 to 6 months. You really need to stay on it that long to find out if it's really helping. If it is helping, then you can slowly taper off of prednisone over time. But it really depends on whether your disease is flaring, whether your PMR pain is coming back or not. And a lot of people can drop from 20 to 15, no problem with PMR. You can even drop from 15 to 12.5 to 10. And most people with PMR are still okay, but it's dropping below 10 milligrams is where it really gets tricky when it comes to prednisone and PMR. And I've made a ton of videos about that. In fact, just this week, I made a whole video series all about PMR. Check it out if you haven't already. And so it really depends on whether your disease is under control and whether or not you're having withdrawal pain. So that's tricky. But PMR in general, people take prednisone for 2 years. That is the average person who has PMR will end up taking prednisone for 2 years. Hopefully that helps. And you've been on methotrexate for 7 weeks. Thank you for that. That helps me answer a little better. Methotrexate maybe has started to help, but probably won't fully kick in for like 3 to 6 months. So it's really hard to know if it's going to help. And then as far as I don't know how effective methotrexate is for arthritis or systemic sclerosis, but for PMR, it works in some people and it doesn't work in other people. So it may not be the best other medication to add on, but it might be the best when we're considering the other diseases as a whole. Other medications that have been shown to be better include Kevzara and Actemra for people with PMR. So those are something you could try if methotrexate doesn't work out. Okay. All right. Thanks everyone for joining me today. This live stream was sponsored by Nutranize Zone. You can get it at nutranize.com or on Amazon. Just click this QR code or the link, and it's exactly what you need while taking prednisone. I created it myself using my doctor of pharmacy board certified expertise and my experience as a patient. So it's exactly what you need while taking prednisone. Go to nutranize.com today to get the support you need. Signing off is Dr. Megan, your prednisone pharmacist.